We begin with breaking news this afternoon. A suspected case of Ebola in Sacramento County. Good afternoon. I'm Andrea Sistio. The UC Davis Medical Center confirms it's examining a patient suspected of having the deadly disease at this hour. CBS 13's Lamore Abrams joins us live from the center in Sacramento County with the latest. Lamore?
Well, Audrey, the hospital remains open and operating as usual, but back there in the parking lot, we did spot a guard wearing a mask. The hospital tells us a patient with symptoms consistent with Ebola infection is being treated here. That's all we know about the patient so far, and it's unclear yet how he or she may have contracted the infection. Here's what we do know. We're told the patient first visited the emergency room at Mercy General Hospital in Sacramento and was transferred here to UC Davis Medical. Good news is UC Davis is designated by the CDC as an Ebola treatment center, and the hospital reinforced that with this statement. Measures put in place to protect the health and safety of hospital workers and patients include extensive training on proper use of personal protective equipment and the establishment of a dedicated isolation room for treatment of suspected and confirmed Ebola patients. I've also reached out to the Sacramento County Health Department. A spokeswoman there says she's also looking into the patient's background and how the patient may have come into contact with Ebola. At this point, there's no press conference scheduled. We'll have updates throughout the day. Again, a suspected case of Ebola here at UC Davis Medical, and protocols here are in place.
All right, Lamore, thanks so much. And you said it, UC Davis is one of only 4 hospitals in California designated as an Ebola treatment center by the CDC. 2 of the other ones are Kaiser Permanente centers in South Sacramento and Oakland. The 4th is UC San Francisco. Back in October, doctors at UC Davis said they brought in extra volunteers to help identify anyone who enters the hospital with symptoms. The possible Ebola patient was transferred to UC Davis Medical Center from Mercy General Hospital. Mercy General confirms the emergency department is closed at this hour. CBS 13's Ron Jones is live at the hospital with the latest. Ron?
Well, I tell you what, I guess this will be considered ground zero. As you pointed out, Lamore pointed out, the patient was brought here to Mercy General Hospital. Now, we have been told by hospital officials that the ER has been temporarily shut down. They're not taking any patients in to the emergency room. We also noticed that there was little activity in and around the ER. We actually had an opportunity to speak with one family. They were leaving the hospital shortly after the emergency room was shut down, and they were surprised by the news.
We hope he's okay. I didn't know anything about it, I guess.
Did they tell you anything to evacuate or to leave the area?
No, we were in the same-day surgery section, so we didn't hear about it till.
So once again, it's confirmed by hospital officials that a suspected Ebola patient was here this morning at Mercy General Hospital. Now, they released a statement saying, in part, Mercy General Hospital has transported a patient to UC Davis Medical Center, which is specifically equipped to care for patients suspected of having or diagnosed with Ebola. Once again, here's a live look out here at Mercy General Hospital. The one thing that we also want to point out, too, that they have not released the name of this patient or the sex of this patient or where this patient came from. Did it come from a West African nation such as Sierra Leone? That has not been revealed so far.
All right, Ron, thank you so much. You might remember the last time we had an Ebola scare in our area was last August. A Sacramento resident who traveled to West Africa was suspected of having the virus. The patient was treated at the Kaiser Permanente Center in South Sacramento and tested negative for that virus. There have been no confirmed cases of Ebola in California. As a reminder, Ebola only spreads through direct contact with the blood or other bodily fluids of an infected patient. Ebola is not spread through the air, water, food, or mosquitoes. Signs and symptoms can appear anywhere from 2 to 21 days after exposure to Ebola. Symptoms include fever, vomiting, and bleeding. And we, of course, will continue to follow this developing story of a suspected Ebola patient at UC Davis Medical Center at CBS 13 News at 4. You can also stay up to date with the latest on our